Hi everyone, I'm here with Dr. Abby Neville, the geriatric house call dentist from Philadelphia and the suburban areas surrounding Philadelphia. And we would like to discuss a very important topic today, very important, and that is dentures.
Yes.
Let's start with partial dentures. Would you like to explain what a partial denture is?
Sure. It's exactly what it says, actually. It's replacing parts of the teeth. So they have some teeth and then they're missing some teeth. So the idea is that the teeth that they're missing are replaced by the denture, and then there's some attachments, the existing teeth, that the partial denture can hold.
Right. Do you do different types of partial dentures?
I do. It's very dependent on the patient, actually. For a lot of my mobile dentistry patients, I need for it to be transitional, right? So I need to make it simple to repair and add to should they lose another tooth or break another tooth, which is very common, but we want to make it easy to add to the denture.
Which brings me to the next question that I'm dying to ask you.
Sure.
Why do teeth fall off of the denture? You know how you have the fake teeth? Sometimes people will call me and say the tooth fell off the denture. Why does that happen?
It's possible, right? Because when they make the denture, they kind of put the tooth into the denture. Well, when you chew on it a lot, and some people chew on the same spot over and over and over again, it will get worn down and it can come out. Another really common thing is dropping the denture. So if the denture's dropped on a tile floor or a hardwood floor, the tooth could break, and so could parts of the denture.
Even in the sink.
Absolutely.
Which is why I tell them to
put it. I know. Yep. They hold it over to clean, and then boom.
And then they blame the caregiver, and the caregiver gets in trouble, and we're really sorry about that. But if you listen to our advice, and that's to put a little washcloth while you're cleaning it. So if you should drop it, because I'm really clumsy, I drop everything.
Well, they're slippery too.
They're slippery.
So because the acrylic is very polished, and so it's easy.
Right. And acrylic is a special type of plastic.
It is.
So tell me about this. I get a call once in a while that now the clasp is just floating on something and I don't know what's going on. What does that mean exactly?
Right, so the clasps are what are used to actually wrap around the existing tooth that's holding the denture in place. And what can happen is same type of thing. The way it's taken in and out, the clasp can actually bend, it can break, it can be dropped, the clasp can break that way too. Or the tooth that's actually holding the denture can fracture. And then it looks like it's floating because there's no tooth there anymore. And that's probably one of the most common.
Oh my gosh, I really feel sorry when I get a photograph of a tooth that's broken that held that denture in, and now they feel so badly that they can't wear it or it's coming down.
Or what can happen too is that clasp can actually grab the lip or the cheek because it was used to being hugging, it was hugging an existing tooth, and now it's just kind of hanging out. So it can hurt someone's lip or cheek.
Sometimes it can be repaired and sometimes it can't.
That's
so
right.
What do you do about that?
So it depends on if that tooth that broke is restorable or not, right? So if it's not restorable, then it's something where we may need to remove that tooth and add it to the denture as a repair. Occasionally the tooth is broken a little bit. We do restore our teeth if we can at their home, and we'll do that as well. And then we can give that tooth the same shape that it was before so that the partial denture will fit again.
So what she's trying to say is every situation is different. If it's a small little break, we might be able to fix it. We may be able to take that tooth out, and if there's a tooth next to it, put the clasp on that tooth. So basically every situation is very different. So we've talked about partial dentures. Sometimes they don't fit, the clasp breaks off, they could break in half. We can fix that. Let's talk about complete dentures.
Okay.
What is the most common reason for maybe a denture to start getting loose?
I would say change in weight, change in health status. That's very common with our mobile patients. Sometimes they have a recent health issue, they're not eating as well, and then those dentures start to get really loose.
Yeah, and that's a big problem because there's only so much adhesive that you could use.
That's right.
I mean, I recommend the Dr. B's products because the adhesives have ingredients that you could actually read and has no taste. So that's great. And I always try that as the first thing to do when the denture becomes loose. But then sometimes the weight loss is 5 to 10 pounds, and then what do we have to do?
We need to reline the denture.
What's a reline?
That basically means we refit it, right? So the shape is changed. Well, we need to adapt to that new shape. So we use a material that can either be soft or hard, depending on the patient. Again, we take it case by case, and we remold the inside of the denture to fit the current shape of their mouth.
Right. Do you use a certain product? Because I only use the Voco products. Do you?
I do use that
You do?
product as well. Yes.
Oh my gosh.
Yes. It's an
Why
excellent product.
do I use it? Why does she use it? I'm sure she knows. I use it because it doesn't delaminate. It's one of the very few products, maybe the only product. I've used them all. It's the only one that you can't peel out if it's a soft reline.
That's right.
And if it's a hard reline, it really does last. And it becomes very smooth with that finishing coat you put on it.
I understand. I like that too. I love the way it, all of them set differently. The Voco product sets really nicely.
Yeah.
And that peeling is a big deal because if it's, once you leave and your patient is using it, if there's these little pieces, if it's not a Voco product, it typically will peel off and you'll get these little, like almost rough edges that will happen, which we don't want.
Or they pick at it and then they come and say it fell out, and we know darn well they pulled it out, but you can't help it if it's falling out, and that's the one product. And the good thing is you could use a hard reline, and then where it's like bothering you, you could take a little bit away from there and put a little bit of soft there. It's the only product that the hard and
you
soft
can use both together.
Exactly.
Yep.
So a reline is the way to go. We love to do them, and I'm happy that you guys are still listening. So thanks for listening.